I'd like to introduce Jay from Surterra.
Some of you folks might recognize me if you've ever shopped at the Surterra location in Gainesville. And if you haven't, I'm really excited to meet you all. I have a really specialized background that's perfectly at the intersection of cannabis and intimacy. I've been working for the past 2 years in the cannabis field at Surterra, doing patient consultation and cannabis education. And so that's been really fulfilling for me watching the impact that cannabis can have on the lives of so many people who really come to us with a lot of diverse experiences and conditions, and being able to watch their journeys in that way has been really special to me, and I've learned so much, and I'm really grateful for the opportunity to share that knowledge with others. And outside of my role in cannabis, I'm also a sex educator. That's kind of the role that I've found for myself within my community, and so that entails really just facilitating different spaces where we all learn together, and talk about our experiences, learn on topics that all of us have different experiences and comfort levels with. So I'm really excited tonight for the opportunity to create this hopefully safe space for all of us to continue learning together and really embark on our own very personalized journeys when it comes to both cannabis and intimacy and the intersection of both of those.
Let's just kind of jump right into this.
Yeah, so Surterra has been open for at least the Gainesville location 4 years now, but as a company, I think 7 or 8. We've really kind of settled into the cannabis industry here in Florida and the medical marijuana program. Something that I really enjoyed so much about working at Surterra is the emphasis that we put on our patients and on the experience that they have. So, like you mentioned earlier, we really take our time with the consultation aspect of the patient experience and really making sure that folks share so much vulnerability with us, and we feel really honored for that, and really hearing them and making sure that we guide product recommendations that we think are going to work really well for them, really getting them a robust selection of products that Surterra offers. This is just kind of a basic disclaimer slide. If you are seeking medical advice, please consult a qualified healthcare provider. We're here to really just share information, answer as many questions as we can, and guide your process. But we're not qualified to give medical advice. So if you're looking for that, please contact your physician or somebody within the healthcare field. Cannabis research, at least, is still a budding topic. Cannabis has been around for a really, really long time, and it's been in a lot of indigenous practices. But when it comes to scientific research, that's still pretty new. But it has been growing in really exciting ways in the past like 5 years, especially. And hopefully that'll be coupled with legislation that decriminalizes and legalizes cannabis, so that way we can get even more research and have the safety and security that we deserve when it comes to that as well. So this is just some kind of disclaimers. Letting you know that this information is ever changing. Everybody is really different. So your individual experiences with cannabis are going to vary. And yeah, that we're all learning together, but hopefully this will be a space where we can give you some really helpful information. Do everything that we can to mitigate any kind of adverse reactions with cannabis. Making sure that everybody is safe and comfortable in their experiences is always a priority. With dosing, we always recommend starting low, going slow, and really taking your time to find the cannabis routines that work well for you. What we know in terms of research is just a little, and I think that there's a lot of reason for that. Both cannabis as well as the field of sexuality have a lot of social stigma and taboo facing them, and that can show up in our personal lives in the way that we're able to connect with our body and with each other, but it also shows up on a social, cultural, and systemic scale. So we just really want to emphasize the point that a lot of what we're going to be talking about is both the existing research that does exist currently, which, like, there are some really good studies about the intersection of cannabis and sexuality specifically, but a lot of it is also based on anecdotal evidence, and so that's why we really emphasize personal and very careful experimentation, so that way you can know how your sensations are going to feel at the intersection of cannabis and
I
intimacy.
know that I had a lot of questions when I first started using medical cannabis, and I chose to use it because I had an injury that left me with herniated discs in my neck, 7 of them. And so I had to be very careful about using medical cannabis. I never used it prior to that particular event, but it's really let me get my life back.
A lot of folks who have no experience with cannabis, kind of get over their hesitancies, really break through the barriers, and are able to use a type of holistic care that works really, really well for them and helps them kind of regain a sense of agency over their lives in ways that they might not have gotten otherwise.
I think that if you're standing in the middle of a dispensary talking to someone like yourself, Jay, and you want to bring up the subject of sex, you may feel it's not something you want to bring up in public. You're kind of worried about talking about it. You have consultation rooms and you do consultations. You can actually go in and say, look, I'd like to have a consultation in this area, and you'll help them.
Yeah, at Surterra, we have like our own private consult rooms, and patient privacy is a really big priority for us. And we really want to make everybody feel as comfortable as they can, especially when, they're talking about things that are really difficult for them and impact them in really challenging ways. One of the most like standout consultations that I had was like a new mother talking about her postpartum, and that was a really emotional time in her life. And so we opted for a private consultation, and I feel like it was able to really help us facilitate like just a really honest conversation, despite that higher level of emotion coming into it. And so that's always an option, and it's great to reiterate that. So we're bringing that up. We always try to start folks at the point that makes them feel the most comfortable. So if somebody's coming in with little to no previous experience with cannabis, we have a lot of ratio products at Surterra that kind of help um, ease your way into it. And we always talk about starting at a really low dosage point. And even though sometimes it can be a difficult ask because it might not give you the immediate relief that you're looking for, it'll definitely help in terms of guiding your cannabis journey and really helping you avoid any kind of experience where you get anxious or you feel like really tired and lethargic. And we just want to make sure that we're being mindful so that way we can keep everybody engaged with cannabis and not turn anybody off too soon.
Cannabis is no different than coffee, caffeine, or alcohol. Everybody has a certain tolerance level for it. I know I have friends from an alcohol standpoint. I have one friend that has one drink and he's done for the night. And I have another friend of mine that when he finishes the whole bottle, he's only getting going. And I think that's the same for cannabis. Every person's body is different. I know my tolerance towards cannabis is very different than my wife's. And I think that's important when we're talking about intimacy because we're looking at two different spectrums here about being careful that we both get to that place where we have what we call our sweet spot at the same time. But I think it's something that don't be shy about that. Every person is just different. And really finding out what your tolerance is, like with alcohol, like with caffeine, is really important to really getting the maximum benefit out of it.
This slide is all about consent, which I think is a really necessary starting point anytime we talk about intimacy or sexual experiences with ourselves and with other people. And so consent is just the explicit permission that is necessary in order for us to engage in any kind of sexual behavior with somebody else. And I can't overemphasize how necessary this is. And so the Fry's model is a really popularized tool for sex educators to really clarify what consent entails because it's a lot more than a simple yes or no. And so FRIES is actually an acronym that stands for freely given, reversible, informed, enthusiastic, and specific. So freely given means that there should be no coercion. It shouldn't be, asking 37 times so that finally a no turns into a yes. It should be something that's free from any kind of manipulation or pressure. And reversible means that consent can be revoked at any time. Informed means that everybody knows everything that they need to in order to give consent. So, for instance, tying this back to cannabis, if you want to introduce cannabis as a part of one of your sexual experiences, that should be fully disclosed before anybody gives consent. And then it should also be enthusiastic. People should be really excited to be engaging in these things with you. It should be something that is going to be pleasurable for everybody involved, and that should really bring about feelings of desire and excitement, and shouldn't be given begrudgingly. And a lot of folks have experiences that were really bad for them. And so to me, good sex is sex that can offer us a chance to heal and like really connect with our bodies in a way that prioritizes our pleasure. And then the S for fries stands for specific, which just means that you need to be asking continuously if you want to try a new cannabis practice during a sexual experience, or if you want to do it at a different time of day or in a different place. All of that requires consent first. And I think a lot of folks think that consent is going to kind of disrupt the mood, but that's just, to me, I think, kind of like a think challenge of how can we incorporate consent in a way that still feels really exciting. And so checking in with your partner to see what they like and what they want, asking specifically if they want you to do certain things, all of that can be really fun practices to have with your partner to make everybody feel a lot more comfortable. Thing that I really wanted to highlight with consent and cannabis specifically is that if you're incapacitated, if you've gone past what your limit is, that's gonna take away your ability to give consent. And same with your partner. I really like how Marc mentioned earlier, what your tolerances are and thus your sweet spots can be different. And so you really want to be careful with the dosing that you're using and making sure it's individualized for yourself and your partners, so that that way you're acting within what your limits are, you're acting within what your tolerance is, you're acting within what is typical for you, and your partner's doing the same. They're not trying to match you, you're not trying to match them. Instead, you're acting within what is typical for you guys, so that that way consent can be maintained. I think something that can be really challenging for folks when it comes to partnered sex is being open and vulnerable, and having an open dialogue with yourself and your partners where you can freely and honestly explore your desires and feelings is really important, but it can also be really challenging. And so when it feels really tough to open up and be vulnerable with ourselves and our partners, especially when we're trying to do so to talk about sex, which can be shrouded in so much shame and stigma and complexity, cannabis can really offer us kind of a nice, comfortable cushion to help us ease into those conversations that we might feel nervous about, but that can really facilitate such an enjoyable experience. Even just, I think, talking and getting on the same page with your partners about what you want out of sex without even doing it can be a way to really connect so deeply with them that it really encourages intimacy in a way that feels really exciting and feels really radical and like different from how certain other like types of sexual experiences can go. So to me, sexual communication is really essential part of any kind of experience you're going to share with another person. But like I said, it can be really, really
Consume
challenging.
cannabis the way you like it. And if you work together on rolling a joint or something like that, that could be a way of getting things started.
For me, I always roll joints for myself. That feels really therapeutic for me. It kind of helps me calm down. I smoke mostly for my anxiety. I am a very anxious person. And
Mhm.
so for me, the act of rolling is something that kind of helps. It's almost like meditative and helps me ease into it. And doing that with somebody else can be really fun. Or if you want to make edibles together, or if you want to, try different vapes together. There's so many different ways to make this an experience of closeness with your partner. And then you can use that, like you said, to kind of help reduce any anxiety you might be feeling before going into a conversation about what you want your sexual experiences with this person to look like. And so, some tools that I think are really helpful for sexual communication are open ended or either or questions. And then it's also been proven that if you initiate with personal disclosure, then your partners will also feel much more comfortable sharing honestly with you. And it's always fun too to leave room for exploration and mutual discovery. You don't have to know everything that you want all the time, but really just making sure you get on a same page with your partner. Or if you even have something in mind that you want to try, being bold and bringing that up, that boldness can be aided with
Well,
cannabis,
since,
right?
literally I was in college, people would say, gee, try cannabis. It's great for sex. I didn't understand why. This kind of explains why.
Yeah, so I think that this is a part of our bodies and our sexuality that sometimes goes overlooked, but our bodies go through a series of physiological responses when we go through our sexual response models. And that sounds really full of jargon, but that basically just means that all of the experiences that we have that are intimate with another person or even with ourselves are coupled with these really specific physical responses of our bodies. And so I mentioned a few of them to kind of give examples and maybe demystify this part of the talk a little bit. But vasocongestion during arousal is something that our bodies experience, and that just means the swelling of tissue with increased blood flow. Also, muscle contractions during
Mhm.
orgasm, which is another part of the sexual response cycle. And so, again, that happens for everybody, regardless of what kind of body parts you might have. And so, cannabis specifically can affect these physiological responses as well. So, cannabis is a vasodilator, which means that it aids in vasocongestion and therefore can aid in the physical sensation of arousal. Cannabis, if you already use it and report being able to orgasm with cannabis, can lead to an increase in the quality and intensity of them. And cannabis is also a muscle relaxer, which can help if you experience pain during sex, which is a really common experience, but it doesn't have to be painful. There's a lot of ways to be able to help ease your body into those experiences, and cannabis is one of those tools that you are use. A lot of different theoretical approaches to what this looks like, and kind of based off of or kind of coupled with what we mentioned earlier, the research in these fields is ever changing, and people discover that some models might experience some people's sexual responses but might not really be reflective of others. And so there's a lot of diversity in the field because there's a lot of diversity in our experiences. And so on the left side of this screen, we have a more linear model, which is the Masters and Johnson's model of sexual arousal, which breaks it up into arousal, plateau, orgasm, and resolution, which are just kind of four stages that can be marked by different physiological responses within your body as you're going through kind of different parts of a sexual experience.
The white line is without cannabis. The yellow line is with cannabis. Is that
Mhm.
correct?
Yeah, so with something that cannabis can be really helpful for is increasing the frequency of orgasm, increasing the intensity of it, and overall just kind of your experience of pleasure, which for a lot of people is not orgasm, which is
Mhm.
also completely welcome and okay. But when it comes to this specific sexual response model, cannabis can be really helpful in making those lines move a little in a way that might feel more suitable to what you're desiring. The circular model, I think, is a lot more inclusive of what our sexual experiences look like. The linear model feels really scientific to me in a way that our bodies and our experiences might not always align with. And so the circular model is newer. It starts with drive or desire and kind of funnels into different areas where you're kind of motivated in different ways, or you might be stimulated in different ways, which can also be impacted by external things like your biology and your psychology. That's kind of where a little bit of, maybe if we experience pain during sex, that's going to make what our sexual response cycle looks like different. Or if we get really, really anxious around other people, that also might impact the way that our body goes through the sexual response model. And then from there, it kind of goes still into arousal and intimacy. And it's much less of a beginning and an ending that's clear cut and more of an all encompassing experience. Pleasure and satisfaction, I feel like we hit on a little bit. But I really want to emphasize too that what constitutes as pleasure and sexual satisfaction is different for everybody. And whether that includes our sensuality or more of what we are physically experiencing, if that means how we're orgasming, that means the frequency of which we're having our sexual experiences, the manner of which we're having them, we all deserve to feel good, and feeling good is allowed to look however we want it to. As we'll see shortly, there's been a study of self reported measures where folks were able to rank how cannabis affected them during their sexual experiences. And most folks of any gender reported either slight or significant increases of a sense of touch, a sense of taste, their desire, their ability to achieve and maintain penile erection, orgasm intensity, orgasm frequency, and just their overall sexual satisfaction. So I feel like that really reflects how diverse these things can look for different folks. Even while advocating for ourselves, exploring our desires, and trying new things can be really helpful in helping us discover what pleasure looks like for us. Cannabis can also be really helpful for that journey.
Here's an interesting, this is from one of the studies that you picked up. I'm not going to steal your thunder, but I do want to point out the scale goes from 0 to 5, not to 10. And this is the rating that people had on different questions. Why don't you take me through a few of these?
Yes. So, like you mentioned, the range of the numbers is really important. So this is the results of the self-reported study that I just mentioned. And so essentially they gave folks who already use cannabis a questionnaire to be able to self-report on what their experiences were while using marijuana during their sexual experiences. And so the scale was 1 to 5, with 1 being significantly decreases, to 5 being significantly increases, and 3 being that midpoint of like not really having much change at all. And so I think with that in mind, it's really interesting to see that everything here is beyond a 3. So that means everybody experienced at least a little bit of an increase when it came to using marijuana during their sexual experiences. And like I said, this is really reflective of the diversity of which they included as their metrics. So there's a lot of different things here, like relaxation or their desire.
You look at relaxation, you got 4+ right across the board, men, women, and overall. No question, it's helping in that area.
Yep. And um, even with their desire to have sex, that's almost out of 4 for everybody too, which I think a lot of folks, at least in my experience of who's coming into the dispensary and asking us really specific questions about using cannabis during intimacy, a lot of them just want to feel that desire. And so I think it's important to mention that for a lot of people, cannabis is really helpful in that journey. Just a very essential component to cannabis in any regard. So whether or not you're trying to use cannabis as a helpful tool during intimacy, really you should be looking at terpenes no matter what intended effect you're looking to get out of your cannabis journeys. With the effects that are listed under each terpene, it's all things that are going to be really helpful in experiencing intimacy. So whether it's relieving your stress and anxiety, whether it's being that vasodilator, really there's so many different ways that these can be helpful. But something I did want to mention as well is that with some of these terpenes, like linalool, that can make you feel a little bit more tired. And so maybe having that be not as dominant in the terpene profile would be really helpful, because while ushering rest after intimacy can be really key and what folks are looking for, you don't want to get tired too soon. So something to just be mindful of with these specific terpenes.
When they talk about low heat down here, we'll talk about if you're using vaping or using flower, what you want to do is you want to keep a low heat so that you can take advantage of each of these different terpenes. If you boil them off, you're not going to get the advantage of the terpenes. Cannabis will still work, but you're not going to get the full effect.
If you are anxious going into sexual experiences with other people, you might be looking for terpenes that are going to make you feel more relaxed. If you experience pain during sex, you might look for something that's going to be anti-inflammatory or more of a muscle relaxant. It should really help guide what specific terpenes are going to be highlighted or the most dominant in the terpene profile of the products that you'll end up using. But you do really want to make sure you're not using anything that's too heavy of an indica or that's not too dominant in terpenes like myrcene and linalool, just so that way you're not getting too sleepy before.
If you take a look at something like inhalation, the onset is almost immediate, and it'll work between 2 to 4 hours, which is great, whether you're smoking flower, you're vaping. But when you look at orals like edibles and things like that, this can take anywhere from an hour to 2 hours of work. And I say that because if you're going to grab a gummy, don't assume that it's going to work in the first 30 minutes. In other words, you want to do this about an hour, maybe two, before you decide to really get together and head into that direction. Really be careful about the timing of this. Your thoughts, Jay?
Yeah, I think that this is also really important to tie back to consent because you're going to want to be careful with the route of administration that you use, and not overdosing or not waiting too long. And something, especially with edibles, is, you know, edibles might kick in faster for me if I have a stronger metabolism or if I've eaten something that's going to help bind all of those cannabinoids while it's getting processed through my digestive system. So
Mhm.
even if you and your partner are taking the same edible at the same time, you might not have the same experience with it, which is why I think it's really important to so carefully experiment and not having too much expectation going into these experiences. I think expectation can really be the bane of pleasurable sex, and so really just removing yourself from that pressure and being really mindful of the fact that you and your partners are going to come into this with, you know, different bodies, different experiences, different tolerances, different exposure to cannabis, different exposure to sex. And so, you know, maybe the first time that you and your partner decide to introduce cannabis into your intimacy routine, you don't go into it planning to have sex and instead just figure out how your bodies feel. Something that we always recommend to folks too when it comes to using different routes of administration, using cannabis in different ways, or even if they're just new to cannabis in general, is keeping a diary, and making sure that you are really mindful in tracking your experiences and the different ways that different types and routes of administration for cannabis can affect you. And so maybe the first time that you and your partners try using cannabis, you go into it with, you know, the intention just to journal together and figure out how you feel affected, figure out how it's affecting your desires and your bodies and your fatigue, so that that way next time you use it, you'll be on the same page. Consent will be able to be clearly defined and you can just have a good time instead of, you know, doing a little science experiment.
Remember, we talked about temperatures and terpenes. If you go and, like you were mentioning, rolling a joint, and you roll that joint, and then you take that flame and you light it, that 550-degree flame is going to burn off about half of the cannabinoids, almost all the flavonoids, and almost all the terpenes, meaning the medical value to really provide the relief or the sensation that you want. You're decreasing that about 50%. That's the bad news. The good news is it still works. Okay. So I'm not saying don't do it. I'm just saying if you want to get more out of that, that's why people use dry herb vaporizers. That's why you see these things like volcanoes and you see these things like these mighty pluses. But those devices let you set the temperature. And so you can set it at 360, you can set it at 380 and be able to get the best terpene profile plus that flower experience. And I believe that spills over into a lot of vape pens.
Terpenes, I think, kind of help ground our cannabis experiences. Whereas if we're just consuming products that are really high in THC, we're just really going to be mostly experiencing that psychoactivity. And I think that that's kind of where we run into the potential of feeling too anxious. Maybe not being in the mindset that we want to be when we're wanting to be, you know, present with our partners and ourselves. So I think it's really important to be mindful of the ways that you're using cannabis all of the time, but especially during intimacy. Topicals can be really, really impactful, for helping release muscle tension or tending to any kind of muscular nerve or joint pain. And so, when it comes to implementing topicals into your cannabis routines, just in general, I'm a huge proponent of it. I think comparatively to the way I used cannabis before being in the cannabis field to now, topicals are like the main thing that I feel my perspective has really changed on. And if you have not tried it yet, I promise you it will be helpful to you if you experience any kind of physical sensations or pain that you're looking to tend with cannabis.
Let's talk. You talked a little bit about dosing. Let's talk a little bit about that sweet spot because what you're really looking for is what you call your therapeutic dose. That's where you're getting the relief that you want with no side effects. And that's what's really important. Um, a lot of people who get into using medical cannabis from a recreational standpoint are looking for that high. And there's nothing wrong with that. But I think if you're looking at it where you and your partner want to enjoy let's just say, an intimate moment together, it'd be great if you were both present and really in a point where you don't have any side effects.
And so when we say start low and go slow, we're really saying start at the beginning. And that's where how I mentioned it can sometimes be a difficult ask for us when we're doing the patient consultations is because it might not give you any relief at first. And so you might not get what you're looking for right away, but it helps you progressively increasing that dose so that you get to that target range, you get to that sweet spot without ever having to overdo it to where you might never want to touch cannabis again. And
Right.
so really taking your time with it is really important in making sure you find your personalized sweet spot because that also looks different for everybody. And so really just even though it can be really difficult, especially because at least in my experience, folks turn to cannabis after they've kind of exhausted all of their other options. And so in those instances, it can be I understand really challenging to wait even longer to find the thing that's going to work for you, but we
Yeah.
want to make sure it really works for you. And the best way to do that is to really take a slow journey to find that personalized sweet spot for yourself. You know, those sweet spots are going to be really highly personalized for each one of us. And
Mhm.
so our sweet spots are all going to look different. Our sweet spots are even going to look different with different routes of administration. Like for me, as Marc mentioned, I mostly use flower, but I also take edibles sometimes. I also vape sometimes. But my tolerance, even with those different routes, feels different. And so even as like a more experienced cannabis user with a higher tolerance, I still make a very conscious decision for myself to really start at lower doses and increase it very gradually when I'm trying a new type of product or when I'm using a type of product that's not what I normally use because our bodies also adjust to what we're using and how we're using it. So for me, smoking in my bedroom, which is, you know, what I'm normally doing, my tolerance feels a lot higher. But then if I'm taking an edible with a different person in a totally different setting, the physical settings that we're in can be correlated to our tolerance. And so, really, just making sure that you are giving yourself grace and really taking it slow and being really careful is how we can make sure that you're not going to have any adverse experiences with things like paranoia or feeling like your body can't move the way that you want because ultimately cannabis and intimacy is all about you feeling like you have agency over your body and making sure that you feel comfortable and you're getting what you want out of these experiences. Still on that topic of dosing, I wanted to really emphasize specific points with that when it comes to using it with intimacy. And so the studies that we've kind of gone over and a lot of the scientific research that already exists is um, showing the most benefit for folks who already use cannabis. And so when you are introducing cannabis into your intimacy journey, you want to make sure that you are feeling really comfortable with your cannabis routine on its own. Just because both of those things can be really sensitive personalized experiences. And so you really want to make sure that you're completely comfortable with cannabis before introducing it into your intimacy practices. We've already kind of talked about how overdosing or using too much cannabis, especially for intimacy, can cause the opposite of what we're looking for. So a lot of folks want to use cannabis during intimacy so they feel less nervous. But if you overdose, you can feel way more anxious than you started off.
You use the word overdose. What you're really talking about is an uncomfortable feeling. Getting a little bit anxious. You feel that your body's not in control. Now, there's a couple of things that you can do. If you're getting to that particular stage, keep a bottle of CBD tinctures around. Take an eyedropper, half an eyedropper, and it'll help lessen the high effect or that negative effect that you're getting from THC. You're not gonna die from this. You don't want to be uncomfortable, but especially if you're using things like gummies that take an hour or two to work, just make sure that you let them work. Be careful, be cool, take your time.
Yeah, thank you for that really important clarification. What I meant by saying overdose was just going beyond that sweet spot for yourself. So we don't mean you're going to get into a range of any kind of dangerous or unhealthy physical experiences. You're just going to get something maybe other than what you intended to get out of your cannabis, especially when it comes to intimacy. So that's why it's really important to do all of that really careful and personal experimentation with cannabis on its own, so that that way you know what that sweet spot is for you, so that that way you don't go beyond that
Where
limit
can I
for yourself.
go to get a product today? Starting with one of my favorite subjects because I'm a chocoholic.
Me too. We're birds of a feather when it comes to the chocolate. Hands down, it's one of my favorite products that Surterra offers in general. I was actually just talking to my manager the other day about how our chocolate is really reasonably priced just for really high quality dark chocolate. It just tastes so good. I love it. This is something else where, we should be mindful of our dosing because sometimes I just want to keep eating it.
I have trouble sleeping. About an hour before I go to bed, I take a couple squares of chocolate because that's my therapeutic dose, and it helps me sleep through the night. It may take an hour or may take 2 hours to work, but they last for 4 to 10 hours. I can sleep throughout the night. Where if I take a tincture drop, which only lasts 4 to 6 hours, it's only going to take me till 2 or 3 in the morning, and then I'm back at it again.
Chocolate is just something I think that we kind of all generally associate as something a little bit more romantic.
Mhm.
And so that can be a really great way to introduce it into your intimacy journeys. And like you mentioned, our chocolate bars are broken up into 5 milligram squares, lower on the end of an industry standard for an edible dose, but that really helps with the precision of dosing. And so that's kind of where you can get into being able to find that exactly right dose for yourself and your partner, and it can look totally different. And even making edibles out of the chocolate can be a really playful and fun way to feel closer to your partner and just kind of elongate what our intimacy looks like even outside of our sexual experience. This kind of, I think, marries really well the terpene slide that we went over earlier, where we broke down these 5 different terpenes that are going to be really especially helpful for intimacy, and then tells you which one of our strains you can find these terpenes within.
Mhm.
And so I think a lot of folks, based off of the pre-submitted questions, based off the questions we're kind of continuing to get in the Q&A, a lot of folks are looking for, which strains are going to help me. And these are the slides that you should be paying attention to when you're looking for that personalized relief. Indica and sativa are kind of these more colloquial industry terms that we use to indicate the types of experiences that you might get when you're consuming certain strains of cannabis. Sativas generally align more with those head highs or a feeling of like an uplifting sensation, more motivation throughout the day, mental clarity, focus. And then indicas usually indicate an experience that might be more of a body high, might help you with those physical and emotional experiences of relaxation. For me, help with muscle tension a lot and pain relief. But those are also just kind of a starting point suggestion is something that I like to kind of phrase it as, because again, everybody's experiences are going to be really personalized. Like, we have a lot of folks who come in, are looking for an experience that aligns with what a sativa should be, and
Mhm.
then don't have that at all. So that's where the terpene profile really is important, because that might be more reflective of the experience that you're trying to get. And then we just put another reminder in here. The indicas that we recommended with these terpene profiles might make you feel sleepy. So I
Mhm.
tried to mention ones like, for me, the banana dolce and the candy punch don't make me feel very lethargic. They don't make me feel too tired like some of our other strains that still had like a similar terpene profile, but maybe might not be so helpful with intimacy, might make me feel. Banana Dolce is really good for relaxation and pain management. The Candy Punch is kind of better for social experiences in what I've experienced with it, where it
Mhm.
kind of helps you feel less anxious in those situations, but without feeling too tired. So hopefully these work really well for you. But again, I really can't overemphasize how helpful logging your experiences are. So if you try one of these strains, writing down the terpene profile for it and then what your specific experience was will help the folks who work at Surterra guide their recommendations for you to make them much more specific to you instead of generalized for what most folks experience with those particular products.
When you look at a product that's made for a particular purpose, they call that a cultivar.
I really enjoyed working at Surterra so much because our research and development team is on their P's and Q's. They really dive into everything as deeply as they can when it
Mhm.
comes to the specificities of a terpene profile. Having like different terpenes present at different levels can also really impact what your experience might be. And so keeping all of that in mind is really important when we're trying to find the specific things that are going to work best for you in the way that you want them to work. Because ultimately, we're just trying to help you make the best decisions for yourself, your body, and your life. And in this instance, your intimacy, your relationship with yourself and with your partners, and we can only, you know, really suggest so much. And so really those terpene profiles are going to help be reflective of what we're referring you to and why.
FSO, full spectrum oil, a derivative of Rick Simpson's RSO. I think the difference is when Rick Simpson made RSO 25 years ago, he didn't use the best cutting agents. He used the best on the market at that time.
A great distinction between full spectrum oil as we make it and Rick Simpson oil or RSO. It's still essentially the same product with the same
Right.
intention. It's just a bit of a progression and a development when it comes to our extraction method and the way that we make the product. But full spectrum oil to me is one of our really cool products because it really maintains a lot of what's present in cannabis as a plant that gives it a lot of its therapeutic benefits. It is really potent and it's a very concentrated version of cannabis, but I like it because of its versatility. So I very rarely ever will just put like a small little dollop on my finger with my food and eat it that way, but I love to make my own edibles with it.
That little syringe over there, you squeeze out about the size of a grain of rice to start with.
I like to eat it with peanut butter because
Mhm.
I think it kind of masks the taste a little bit. And there's a lot of saturated fats in peanut butter that help the FSO bind while it's going through the digestive process and makes that absorption of it a little bit more effective. I really like using FSO in ways other than that because it can get kind of difficult to use it in like a single use every single time.
Sure.
So instead, I take the full spectrum oil and I infuse it with coconut oil. Coconut oil also has the types of fats that bind really well to different cannabinoids. So you're really maintaining a lot of the product and its efficacy. But then with what you can do with that coconut oil is like an endless fun little playground for you to explore by yourself with your partners. You can use that coconut oil to make your own topical products, find your own like massage candles or massage creams that are going to be really enjoyable for you and your partners to use.
Mhm.
You can even use it as a lubricant, which can be really helpful if you experience pain during sex. It'd be a very bold endeavor to try to use this straight to the skin. It's very waxy, so you're not going to want to use it by itself
Yeah.
without going through that step of infusing it into something else. So
Mhm.
for me, it's coconut oil. I like that because it's also plant-based, so I can use that coconut oil again in different edible recipes. I use it to cook and also to bake, which can also be a really fun experience to share with another person during intimacy. I take like a 12 fluid ounce container of coconut oil. I take the whole thing, I put it into a little pot on my rickety little stove. I heat it up until it's completely liquidated. And then I take the full syringe of full spectrum oil. And then depending on what the specific milligrams of that particular batch of FSO that I had received was, I do some math. And with that, you can decide how potent that amount of coconut oil is. Then I take it and I let it kind of settle back into room temperature to where you can work with it more easily. Also, if you're using it for your body, you're going to want to make sure that it's at a cooler temperature, unless temperature play is something that you've consented to with yourself and your partner.
Now, we talked about vapes before, and I'm going to let you walk through the vapes, but I wanted to point out over here, this one vape that you have, notice the three little dots that are on here. This is the low, medium, and high. This lets you be able to set the temperature range to get the most out of your cannabis. Where over here, there's no dots. It's going to give you one temperature, 390 degrees.
At least at Surterra and really most other places within the cannabis industry at this point, there's a really diverse selection that you can pick from when it comes to vape products. For us, we have our full spectrum cartridges, which you see on the left attached to the battery with the three dots on it. We also have distillate cartridges, which would fit onto that same battery and has a similar type of oil as what's in our all-in-one device, our disposable vape, where you don't even need to have a battery for it. All of it is an all-encompassing device that is just inhale activated and works right away for you. But within those three types of products, we have such a big range of specific strains and products within those categories that you can really nail down the ones that are going to work really well for you. And another thing that I wanted to highlight with vapes is that they have a quick onset time similar to that of flower. And so you can kind of readjust your dosage pretty easily because you're going to feel those effects in just a couple minutes or almost immediately. That really helps when it comes to, taking it slow, maintaining consent, and there's a lot of different options. Like for our disposable vapes, we have our Surterra Wellness line available in those, which offer different ranges of ratios of CBD to THC. And so I think, regardless of whether or not you're new to cannabis, our Soothe disposable vape is really helpful. It's 1 part CBD to 1 part THC. So it doesn't really give you a lot of psychoactivity, but still gives you that sensation of relaxation and calmness. And it also really helps just relax your body. And so I think that kind of mirrors a lot of what people might be looking for out of using cannabis with their intimacy. A lot of folks might not be aware of how regulated the medical marijuana market in Florida is. It's through the Department of Health. There are so many checkpoints of testing and quality assurance that goes into getting the product from the cultivation facility to the production facility, eventually into the hands of the dispensary, that you can be really assured that you're not going to be getting anything unsafe. Sometimes folks too just have very natural hesitancies when it comes to vaping or smoking, especially if maybe they're coming from a history of lung health in their family. And so that's where I really want to emphasize that that's not all that cannabis is. There are so many other routes of administration, whether it be like our Surterra Wellness line that I just mentioned for the Soothe isn't just available in a vape. It's also available in a lemon flavored lozenge, in a tincture, in Theragels, which are little pill capsules. So there's a lot of different ways that you can really make sure that how you're consuming cannabis fully reflects what you're comfortable with.
Final thoughts on this particular presentation?
I just really want to emphasize how thankful and honored I feel to be able to present this information to you folks. I think we all have lots of different experiences and comfort levels when it comes to intimacy, sexuality, and cannabis, and being able to have and share this space where we're able to just all learn together is something that I find really, really important. And so I want to thank everybody for being here. And I also want to emphasize that a lot of folks never receive adequate sex education. And so this wasn't meant to be like an all encompassing, sex ed one-on-one. And so instead, there are lots of different ways that you can find that information. So some of those are listed here. The next slide on this has the references that we used for different scientific articles that really informed a lot of the information that we presented you with. I think shame and stigma clouds a lot of our life, whether it be with cannabis or with intimacy, and we deserve to feel liberated from that collectively. And so that's why I'm really glad we were able to all be here together to learn and grow.